Hey health warriors! Ever wonder why someone suddenly loses vision in one eye or struggles to walk despite being otherwise healthy? Today we're diving into multiple sclerosis or MS, an unpredictable autoimmune disorder that affects the brain and spinal cord, impacting everything from movement to memory. Multiple sclerosis is a chronic autoimmune disease where the body's immune system mistakenly attacks the myelin sheath, the protective covering around nerve fibers in the central nervous system. This demyelination causes slowed or disrupted nerve signals, inflammation and scar tissue, also known as sclerosis, progressive damage to brain and spinal cord pathways. MS is most commonly diagnosed in people aged 20 to 40, and it's more common in women than men. Common symptoms of MS include vision problems, blurred vision, optic neuritis, double vision muscle weakness or spasticity. Fatigue, one of the most disabling symptoms, numbness or tingling, often in limbs, difficulty walking or maintaining balance, bladder and bowel dysfunction, cognitive issues, memory, focus, or mood swings. Symptoms may come and go or worsen over time, depending on the MS type. A multiple sclerosis comes in several forms. The most common type is Relapsing-Remitting MS, or RRMS. This form is characterized by flare-ups followed by periods of recovery. Secondary progressive MS, or SPMS, starts as RRMS but gradually becomes more steadily worsening. Primary progressive MS, or PPMS, involves a gradual worsening of symptoms from the start. Lastly, there's clinically isolated syndrome, or CIS, which is a single episode that may or may not lead to MS. Diagnosing MS involves several steps. An MRI with contrast is often used to detect plaques and lesions in the brain and spinal cord. A lumbar puncture or spinal tap can look for oligoclonal bands in the cerebrospinal fluid. Evoked potentials test how quickly nerves conduct signals. It's also crucial to rule out other neurological conditions to confirm a diagnosis of MS. Diagnosis isn't always easy. It often takes time, repeat imaging, and tracking symptoms over months or even years. When it comes to managing multiple sclerosis, there are several treatment options available. First, we have steroids such as methylprednisolone, which are typically used during acute flare-ups to help reduce inflammation. Next, we have disease-modifying therapies, or DMTs. These are designed to slow the progression of the disease and reduce the frequency of relapses. DMTs can be categorized into three main types: injectables, oral medications, and infusions. Injectables include interferon beta and glatiramer acetate. For those who prefer oral medications, options like fingolimod, dimethyl fumarate, and teriflunomide are available. Lastly, there are infusion therapies, such as ocrelizumab and natalizumab, which are administered through an IV. Each of these treatments plays a crucial role in managing multiple sclerosis, offering hope and improved quality of life for those affected by the condition. Symptom management includes muscle relaxants, physical therapy, antidepressants, and bladder medications. For lifestyle support, consider low-stress routines, regular exercise, vitamin D, and effective fatigue management. There's no cure yet, but with early diagnosis and the right treatment plan, many people with MS live active, fulfilling lives. Have you cared for someone with MS or have MS yourself? Share what's helped in the comments. We learn best together. Like, subscribe, and follow for more clear, compassionate breakdowns of complex conditions that impact daily life. And remember, understand MS, manage the flare, empower the patient.